Hey everyone, and welcome to This Explainer. I'm going to be your medical guide today, breaking down the stark, physical realities of drug and alcohol withdrawal. You know, we hear the word detox thrown around all the time in pop culture, usually talking about juice cleanses or some fancy wellness retreat. But in the realm of addiction medicine, detox is a highly volatile, completely serious biological process.
Look, as an addiction medicine physician, the absolute most dangerous myth I encounter is that withdrawal is just about feeling sick for a few days, that you just need to sweat it out. Well, the reality is, depending on the substance, attempting to stop without clinical supervision isn't just incredibly painful, it can literally be fatal. All right, here's our clinical roadmap for today. First, the reality of withdrawal. Second, the cold turkey illusion. Third, kindling, why it gets worse. Fourth, red flags and delirium tremens. Fifth, the polysubstance danger. And finally, the safest path forward. Let's dive right in.
Section 1. The reality of withdrawal. To really grasp why this is so dangerous, we have to look at your foundational biology. Your body absolutely loves homeostasis, internal balance. So when substances alter your neurochemistry over a long period of time, your body actively adapts to counter those effects, just to keep you functioning. It's kind of like building a massive dam to hold back a river. So what happens when you suddenly remove the drug? The dam breaks. Your system is left in a dangerous state of unopposed hyperreactivity. The very mechanisms your body built to protect you from the drug are now firing completely out of control.
Moving to Section 2, the cold turkey illusion.
It honestly alarms me how many people attempt the unsupported living room detox thinking sheer willpower is going to be enough. But attempting a cold turkey detox at home, especially from alcohol or sedative hypnotics like benzodiazepines, invites severe mortality risks. We are talking about totally unpredicted, untreated seizures and incredibly dangerous shifts in your vital signs. Medically managed care, on the other hand, utilizes continuous 24/7 monitoring and symptom-triggered medications to prevent these exact catastrophes. It literally transforms a life-threatening crisis into a safe, medically controlled transition.
Section 3. Kindling, why it gets worse.
A lot of folks tell me, hey doc, I've detoxed before, I can do it again, no problem, right? Well, actually, scratch that logic. From a clinical standpoint, that's incredibly dangerous, due to a biological mechanism called the kindling phenomenon. Basically, every time you go through withdrawal, your nervous system remembers the trauma. It gets more sensitized. This means that even if a previous detox was mild, your subsequent episodes become progressively more volatile, massively escalating the risk of severe complications like seizures.
Here's what's happening under the hood. When you repeatedly hammer your brain with sedatives like alcohol or benzos, and then pull them away, your brain's calming system, the GABA receptors, gets completely blunted. Simultaneously, your excitatory glutamate system goes into absolute overdrive. It's exactly like your brain is slamming its foot on the gas pedal, but someone came in and completely removed the brakes.
Okay, Section 4, red flags and delirium tremens.
This neurological overdrive brings us directly to the most critical medical emergencies. Let's look at how this builds chronologically. From 6 to 24 hours after that last drink, you'll see mild tremors, anxiety, lots of sweating. But hit that 12 to 48-hour mark and the risk of life-threatening seizures really spikes. If that withdrawal is still not managed, by day 2 or 3, the patient can plunge straight into the most severe stage, delirium tremens.
Delirium tremens, or DTs, is a truly terrifying medical emergency. We're talking extreme blood pressure changes, a racing heart, and a profound, crushing feeling of impending doom. Patients often experience very vivid visual and tactile hallucinations. There's this one specific phenomenon called formication. It's the sensation of bugs or spiders literally crawling on or right under your skin. Now, I want you to really absorb this statistic. Historically, without treatment, up to 40% of delirium tremens cases ended in death. 40%, mostly from cardiac arrhythmias or respiratory failure. However, if you get that person into modern, aggressive medical treatment in an ICU, that mortality rate plummets to between 1 and 4%. Medical intervention is quite literally the difference between life and death here. Because the stakes are this high, we have a red flag checklist for immediate hospital admission. If you or a loved one are exhibiting severe confusion, those tactile hallucinations, untreated vomiting, extreme blood pressure changes, or a heart rate spiking over 100 beats per minute, this is absolutely not the time to try and wait it out in bed. It is time to call 911, period.
Section 5. The polysubstance danger.
Now, everything we just discussed, that was just about a single substance. The danger multiplies exponentially when we factor in polysubstance use. When someone is detoxing from multiple substances at the exact same time, say alcohol and prescription opioids, the clinical picture becomes incredibly unpredictable. Symptoms overlap, they mask each other, or they aggressively compound. It requires really acute medical triage to prioritize and treat the most lethal symptoms first.
When we're performing this medical triage, the priorities are pretty stark. Opioid withdrawal is intensely agonizing, severe nausea, muscle cramps, deep bone pain. But, provided dangerous dehydration is managed, it's rarely fatal on its own. Sedative hypnotics like alcohol or benzos, though, those are directly life-threatening to withdraw from. Abruptly stopping benzos can cause rhabdomyolysis, where damaged muscle tissue actually dumps into the bloodstream, leading to kidney failure, alongside those fatal seizures we talked about.
Which brings us to Section 6, the safest path forward. Given all these massive, life-threatening risks, the safest first step is always a highly controlled clinical environment. Continuous monitoring and symptom-triggered medications using long-acting replacement drugs like phenobarbital for alcohol or buprenorphine for opioids are specifically designed to lower the risk of fatal seizure activity. We pair this with massive nutritional support like intravenous thiamine to prevent permanent brain damage, and finally, an immediate, warm handoff straight into ongoing long-term therapy. Because detox is just the starting line, guys, not the finish line.
And this proper continuing care is absolutely vital because of post-detox overdose risk. When you go through detox, your body's physical tolerance drops drastically. If you detox alone or use one of those questionable rapid anesthesia clinics, and then you relapse, using your previous typical dose of opioids can so easily result in a fatal overdose because your body simply can't handle it anymore. Medically managed tapers combined with real therapy dramatically lower this risk. So, I want to leave you with this final thought to consider for today's explainer. If you wouldn't perform major heart surgery on yourself in your living room, why on earth would you attempt to manage a potentially fatal neurochemical emergency on your own? The medical reality is crystal clear here. Withdrawal is a critical medical condition, and seeking professional help isn't a sign of weakness. It's the smartest, absolutely most essential step towards survival and recovery. Thank you so much for joining me, and please, stay safe out there.